Assalamu alaikum and welcome to the 7th workshop for Community Companions. I'm your host and project coordinator, Zebunisa Rao, and I'm pleased to meet you all here today. My co-host today is Farzana Siddiqui. Assalamu alaikum. Sister Farzana is a trained counsellor and member of our team. Community Companions is a project of Hounslow Muslim Centre designed to support the elderly and vulnerable in our community. Today is the 7th workshop in a series to help engage and empower the elders in our community in matters related to medicine, mental health, legal matters, hobbies, and social activities. Our guest today is Zahra Siddiqui. Sister Zahra studied dentistry at King's College London. She's a general family dentist and an advanced facial aesthetics practitioner. She has her own dental clinic in West Byfleet, Surrey, and she's also a wonderful mother to 3 young boys. Our topic today is about how to take care of your teeth. A lengthy introduction isn't really needed as to how important this topic is. Achieving health takes a lifetime of care, and so care for our teeth from an early age is paramount, as is maintenance throughout our life to prevent issues such as tooth decay and gum disease. As with anything, over time we might cut corners and become careless, and so to help us return to what is necessary in oral hygiene, we look to Sister Zahra. Over to you.
Thank you so much. Assalamu alaikum, everyone. Thank you for taking time out, especially when the weather's so lovely and you could be spending it outside. Thank you so much for a perfect introduction. Actually, that's exactly what we're trying to do, is just to give everybody a general overview on how to take care of their teeth and preserve their teeth from age 0 all the way up to 100, inshallah. Allah bless us all with long, healthy lives. And I think the most important thing is that you're right. Healthy habits start young. And if we instill them from a young age, then we will carry them through into adulthood. And I think especially it's a real misconception that people think, oh, I'll only go to the dentist if I have a problem. But they don't realize actually starting young and having their teeth checked and visiting the hygienist will actually alleviate and prevent problems in the future. And we do say that children's teeth, they come out from the ages of 6 months to 2 years. And the Department of Health actually recommends bringing a child in from the minute their first tooth comes through. And I know a lot of people think that that's a bit strange. It's going to be very difficult to check a baby's tooth, get them into the dental chair. But actually, it's more about getting them familiar with the dental environment and the clinical setting. Because unfortunately, in the UK, there are over 60% of adults are scared of the dentist. So dental phobia is a huge, huge thing. And a lot of it stems from bad experiences in childhood, but a lot of it, a lot of parents pass on their fears and their phobias to their children. And we really need to stop that, because I know nobody likes coming to the dentist, but it really is an essential part of taking care of yourself. I do recommend obviously coming into the dentist from a very young age, but also cleaning a baby's tooth from very young, from the minute they come through. So you might not necessarily be able to get a toothbrush in there, but there are lots of baby brushes that you can find, which are simple little things that you can place on your finger, or putting a little bit of toothpaste on a muslin and just making sure you clean them. And we recommend brushing and supervising your children's teeth all the way up to 7 years old, because it's very common that we kind of brush the tops of our teeth, but we never go all the way down to the gum line. And these are things that we need to instill from a young age. And I know, Sister, you were discussing earlier about how your child likes to have, is it fruity toothpaste or whatever? They can use any toothpaste, to be honest, but you have to make sure that the toothpaste contains fluoride. And that's for children and for adults, because fluoride is a mineral in toothpaste that protects our teeth, keeps them strong, prevents cavities and holes. And as long as your toothpaste contains over 1,400 parts per million fluoride, it's fine. So the World Health Organization has actually said that from birth we can use adult toothpaste on children as well now, but use a very small amount, because they tend to swallow quite a lot of it. And the too much fluoride is obviously quite toxic in the body. So just a very, very small, almost less than a pea-sized amount for small children is fine. And just to make sure that you're cleaning twice a day, in the morning, in the evening. Obviously, as they get older, we recommend 2 minutes. And 2 minutes it is quite a long time, and very few children have the patience, but you can get little egg timers, or set a timer on your phone. just to get them into the habit, because as the earlier we start these habits, the better, to be honest, things will be in the future. We also recommend that try not to put sugary drinks or squash into bottles or beakers, because their teeth will literally be bathing in sugar overnight and during the day, and it can lead to a condition called nursing caries, which is where they get quite a few cavities in their front teeth and around their back teeth. And I know a lot of parents, especially Southeast Asian parents, think, oh, it doesn't matter, they're going to lose their teeth anyway. But what you don't realize is actually, God forbid your child does get an infection. Abscesses can lead to bacteria in the bloodstream, which can be fatal. A very big swelling can block the airway, cause difficulty breathing. And also, when you have infection of a baby tooth, it can actually damage the adult tooth that's developing underneath. And then you end up with a lifelong set of problems to deal with. So it is very important that we take care of these teeth. It doesn't matter that they're only there for the first 10 years of their lives. It's and also baby teeth guide the way the adult teeth come through. So if you lose baby teeth very early on, the adult teeth have no path of guidance, and they can come through very, very higgledy-piggledy, and it leads to just very complicated braces and orthodontic treatment in their teenage years. So that's why it's so important to preserve them. Obviously, starting with children, they will have milk in their bottles, but in between meals, really, really emphasize the importance of trying to stick to water. Fruit juice and things, okay, fine with breakfast, or as a special treat is fine. But what we're seeing a lot of actually is amongst the educated classes, children are developing cavities through smoothies, fruit juice, raisins, dry fruit. And dry fruit, actually, we think it's a healthy snack, but it sticks to the teeth. And you're better off giving your child some chocolate, because actually it comes off a lot easier. For example, a little box of raisins contains about 4 teaspoons of sugar. And so what we don't realize is actually this is why the educated classes are getting tooth decay, whereas the uneducated are still giving their children fizzy drinks and sweets and chocolates. But it is something to be aware of, that even a little bottle of orange juice contains about 9 to 10 spoons of sugar, and a can of Coke 11 to 12. So actually there's not that much difference. But I would like to think, fizzy drinks are our arch nemesis as dentists. If you put an experiment would be to put a tooth in a glass of Coke, and you can just see that the entire tooth would dissolve within a few days. And it just shows how damaging fizzy drinks can be, because it's a combination of the sugar and the acid that leads to cavities. And a lot of people think, okay, well, it's great, I'm drinking Coke Zero or I'm having sparkling water, but it's actually the fizz. It's called carbonic acid that's so damaging to the teeth. So it's really best to try and avoid fizzy drinks if you can. And if you do want to have fizzy drinks, have it with a meal, because it's not the amount of sugar that we have that leads to cavities, it's actually the frequency. So if you want to have a sugary drink, drink it through a straw, because it limits contact with your teeth. And also to limit it to meal times, because if you reduce your frequency of acid attacks, that's a lot better. So for example, for children, they're better off eating all their sweets in one go rather than grazing on them throughout the day, because the more acid attacks your teeth have, the worse it is. You have a higher chance of developing cavities. And I know, growing up, we've been taught as well that the best thing to do is, once you've had something sugary, brush your teeth straight away. Actually, that's the worst thing you can do for your teeth, because the minute you eat or drink anything, your mouth becomes very acidic. And if you brush straight away, you're actually helping break down the enamel, which is the outer layer of your teeth, which is responsible for your cavities. So it is tricky, because we think we're doing lots of useful things, but ideally you want to leave it 45 minutes before you brush your teeth after eating or drinking anything. And that's why it's so important to brush your teeth first thing in the morning before you have breakfast. And I know, people feel like their mouths aren't clean. You can always rinse afterwards, but and also before bed, try not to eat or drink anything an hour before bedtime. With children, I know, I've got them, and obviously it's a toss between having a good night's sleep, so we give them milk in a bottle. But as they start solids and they're not requiring milk as much, I really would recommend diluting it with water very slowly as the weeks go on, and then eventually switching to water altogether, because they don't actually need milk at night. It genuinely just becomes a habit. And because milk also has a lot of natural sugar, your teeth are bathing in it throughout the night. Another misconception is that, I know culturally we're taught to brush our teeth and then to rinse our mouths with water. But ideally, if you just brush your teeth and spit, it's actually a lot better, because the beneficial components in toothpaste, such as fluoride, are then able to work around your teeth and prevent any further things. So rinsing is actually a bit of a fad. And we don't really feel like our teeth are clean because it's still got toothpaste in there. But definitely before bedtime is just to spit and not to rinse. A lot of people ask, oh, what do you recommend? Do you recommend a manual toothbrush or an electric toothbrush? For children, personally, I still think it's important to learn how to brush your teeth with a manual brush, because I don't know about anyone else, but mine tend to switch the electric toothbrush on and just stand still. You still have to make sure that you're cleaning all the surfaces correctly. And I do think as we move into teenage years and as adults, an electric toothbrush is 25% more effective at removing bacteria and plaque from your teeth. But I do think definitely for the first 10 years, I would recommend a manual toothbrush for children. And other things to watch out for with regards to children is like, try to encourage healthy snacking in between meals, things like cheese, carrots, rice cakes. Cheese is excellent for teeth. Obviously, it's not very good for your cholesterol, but it's very good for your teeth because it's very good at soaking up and neutralizing the acid that we have in our mouths. And sweet treats and things, it's fine to have dessert after a meal. If you want to give them fruit or a biscuit or donut or anything like that, it's best to stick to after meal times. That's okay. Another reason it's so important to come and see us as your children, while your children are young, is that we apply a fluoride varnish to their teeth every 6 months, right up until the age of 16. So that really does help strengthen their teeth and keep their teeth strong, preventing cavities. But we also can check the development of your children's teeth. So making sure they're coming through at the right stage, making sure they're straight, or if they need further treatments such as braces. One thing I can't emphasize the importance of enough is when your children start to play contact sport, such as rugby, football, hockey, it's very important to come to your dentist and actually have a proper custom-made sports guard, because we see a lot of trauma of adult teeth. And once you break your adult teeth, it is just a lifelong sentence of treatment, and it's horrible for a child. So a lot of people buy these boil in a bag sports guards, but actually they don't fit correctly. And I appreciate that the dentist custom made ones are a lot more expensive, but actually if you weigh up the risks of damaging their adult teeth, it really is invaluable. Another thing I would say is, as we head into teenage years, is obviously to encourage children to start flossing, to clean in between their teeth, because a toothbrush never gets in between our teeth. We think we're doing a great job cleaning twice a day, but actually all the bacteria sits between the teeth. And it's only when you start flossing you realize actually how much is left behind. And if that bacteria sits there, it will lead to holes in between our teeth. It will lead to gum disease. So again, encouraging good, oral hygiene habits and good oral diet habits from a very young age are really, imperative for children and heading into adulthood. As we get into adulthood, I would say we're not just checking your teeth and making sure your gums are healthy, but we're also we do a mouth cancer screening test every time you come in for a checkup. And you might not have any idea that this is happening, but it's very, very important as well. Things like smoking. Also, amongst the Southeast Asian community, we chew a lot of ban, tobacco, and very high risk of mouth cancer. So it is very important to make sure that the soft tissues in your mouth, your tongue, your cheeks, the back of your throat, everything is checked, because it's impossible for us to do this, but when we're checking our teeth, and that's really important. But also, we're also very susceptible to gum disease. And gum disease is when bacteria attacks the bone around our teeth and our teeth become loose. And as well as Pakistanis and Asians, we are very prone, 4 times more likely to develop gum disease and for our teeth to fall out. So it's very important to come in to see the dentist, to see the hygienist who could do some professional cleaning, because we get a layer of buildup around the backs of our teeth, which almost calcifies, and you can't get rid of that with a toothbrush. And the longer that sits there, it tends to lead on and our teeth will eventually fall out. There are a lot of health conditions and medical conditions that make us more prone to dental problems, such as diabetes, heart disease. There's a link between heart disease and gum disease now. And recently, there are a lot of studies to show, especially amongst Asian men, there's a very high link of Alzheimer's and gum disease. So it really is imperative that, you know, you come in and you really do take care of your teeth, because there are lots of studies to show that the bacteria in your mouth can end up in the valves around your heart. So we really need to keep this at bay. Pregnancy as well. Pregnancy can affect your gums quite badly. And I mean, the one good thing about NHS dentistry in this country is that you get free NHS dentistry while you're pregnant and also a year after. And that's, you know, really important as well. One thing I would say is that before traveling, it's quite important to make sure that you have a checkup a good few weeks before, because the last thing you want when you're abroad is a dental emergency, because in this country, we're very heavily regulated in terms of how we sterilize our instruments and how, you know, our needles are disposable, they're single use only. But a lot of developing countries, nobody is checking to see what they're doing. And there's a very high rate of catching hepatitis C in especially in countries like Pakistan and India. And hepatitis C is a bloodborne disease which can actually kill you. So it is very important, you know, having a checkup before you travel, just to make sure everything is fine. Obviously, you can't predict if the inevitable is going to happen, but also when you're flying and you end up, you know, with dental pain, the pressure inside an airplane can really, really cause quite bad toothache, and you really don't want to suffer. Other than that, I think culturally, we're not really encouraged to visit the dentist that much, and I do think it's very important that it's one thing that we all try and do, and to encourage, because people really truly don't understand the importance of it. And also, as we head into, you know, our 70s and 80s and people start wearing dentures, even though you might not necessarily have any teeth, we still have to make sure your mouths are healthy, because there are various conditions that you can get, such as thrush in the mouth, which can lead on to, if it's left untreated, can lead on to cancerous conditions as well. As we head into menopause, there are certain conditions called burning mouth syndrome, and just various changes in the mouth that can occur with underlying health conditions which people aren't aware of. Other than that, I'm just trying to think of anything, if I've missed anything out. Dental tourism was very popular pre-COVID, where people were going off to countries such as Poland and Hungary for very cheap dentistry. You do have to be careful. There are some reputable companies out there. For example, they'll do their checkups and everything in the United Kingdom, but you must make sure that your dentist is registered with the General Dental Council, because if you have any problems and anything goes wrong, your aftercare really is not covered in this country at all. So I'm just diverting very slightly, but again, I can't emphasize the importance of, you know, healthy eating, really fizzy drinks and sugary drinks, trying to keep them to a minimum. Also, what's quite fashionable these days, people are drinking a lot of lemon water, which is very good for your health, and there are amazing health benefits, but lemon water is incredibly acidic for your teeth. So again, trying to, you know, drink these things through a straw. During the day, if you are having a lot of, you know, sugary drinks and fizzy drinks, sugar-free chewing gum is very good to chew throughout the day, because again, it is neutralizing the acid in the mouth and really does help reduce the rate of tooth decay. In terms of, you know, finding an NHS dentist in your area, I think you're very lucky in the Hounslow area. There are quite a lot of NHS dentists. I would say the difference between NHS and private dentistry is that NHS dentistry provides you with whatever's functionally necessary, so not necessarily cosmetic treatment. So if you needed a filling on a back tooth, they would provide you with a silver one. If you wanted a white filling, they would charge you privately. Private dentistry is obviously the materials and the time that is spent doing the treatment is a lot longer. The materials are far superior, but that's not to say that NHS dentistry is bad at all. I've been an NHS dentist for many years, but it's just something to bear in mind that if you do want cosmetic treatment, it's not covered on the NHS. That is all done on a private basis. Other than that, I think just, a few take-home messages, key messages are brushing twice a day, flossing, using something to clean in between your teeth, visiting the dentist and hygienist every 6 months, and keeping your sugary snacks and drinks to a minimum. Everything in moderation. I mean, I'd be a hypocrite to say that I don't have any sugar. I have a very sweet tooth, but just trying to limit it and understanding that obviously the health, risks, childhood obesity, things like that are also on the rise. So we often think that, rewarding our children with a sweet treat, we need to try and move away from that and find other ways to, reward our children, such as stickers and reward charts, because we often think it's a great way to show them love is to give them something sweet, but actually in the long run, it's more detrimental. I hope I didn't bore everybody too much, but if anyone has any questions or anything they'd like to ask me, please
Thank you. That was an incredibly interesting and informative presentation on the topic. I've just been writing notes non-stop. There's so much information that you've given me, which I wasn't aware of before. I mean, there's one thing just on the top of, everything that you've just said, the method of brushing teeth. I remember when I was at school, we were told to do round brushing, so around the tooth, and then now I think it's more about from the gums downwards. So
yes, I should have actually, I didn't get a chance. I should have put my little tooth model in, but you're angling your toothbrush towards your teeth and your gums, and just very gentle circular movements. So I mean, it's a catch-22 because some people, they think, oh, the harder we scrub, the cleaner our teeth will be, but actually you can cause quite a lot of damage brushing quite hard. So just tipping it at a 45-degree angle towards the gum line as well. Okay. And always remembering that, you have 4 surfaces to your teeth. So the outside surface, the inside surface, the biting surface, and around the gum line. So just making sure you're covering all surfaces whilst you're cleaning.
And is it okay to have hard brushes, or should we just?
No, I would, personally, hard brushes can be very damaging because just around the gum line, you can get, the gums can start to what we call move down. So it's called recession, where your gums begin to recede. And that can cause a lot of sensitivity with time, and it can lead to a lot of problems. So I use a soft-headed brush. I know a lot of people don't feel like their teeth are really that clean, with the soft-headed, but actually a soft-headed brush or an electric toothbrush, but as long as it has a pressure sensor, I would really recommend. And it doesn't have to be a very expensive, fancy toothbrush. I mean, Amazon and Tesco's, they're always having a lot of good deals. But as long as you have a pressure sensor, you know that you're not damaging your gums any further.
Okay, we can open the floor to questions now. You're welcome to turn on videos, introduce yourselves, and ask the questions. Otherwise, you can also send them into the chat room, and I'll read them out from there.
Should I go first?
Yes, you have a question, I know, Brother Yunus, so please go ahead.
A couple of questions, actually. Hi, Zara, my name's Yunus.
Nice to meet you.
How are you?
I'm fine, thank you.
My first question is around sugary drinks. At what age should you be able to drink sugary drinks at, and why?
0. No age. No, I mean, to be very honest, I think obviously you can't deprive children, but it depends. I think fizzy drinks should. I don't have kids. You have kids. I think personally, fizzy drinks should not be introduced until they're teenagers.
I have a 3-year-old, and I'm trying to deprive him of it, but it's the fight against the other children.
And I think and also just to use it as a really, really, really special treat, because genuinely, if you do have children and you lose a baby, to put it in a glass of Coke, and you will see how damaging it is. Even if if you boil an egg and you put an egg in a glass of Coke, you will see what happens to the shell. And if you see that, it really is, it's not good. I mean, I had never introduced fizzy drinks to my children until they went to Pakistan, and at weddings, everybody's drinking fizzy drinks. And I said, they're not available in the UK. We don't have this stuff, but unfortunately we have got grandparents that do spoil these children.
Yep.
Yeah.
Not
And I
naming
find at
names.
weddings they do.
But if you're going to give them a fizzy drink, give them it with a straw and with a meal,
Okay.
but as a very, very, very special treat.
With a
Thank
straw.
you. Thank you for that answer. Do you have another
Thank you.
question? Deborah?
But sorry, I just
No.
had one thing to say. It's also
Yeah.
children that play a lot of sport. You see a lot of them drinking Lucozade. One bottle of Lucozade has 12 spoons of sugar in it. And we see I see so many children that are very sporty but have horrendous teeth. And you have to try and strike a balance between, obviously they need energy, but try and stick to low sugary drinks because it's not good at all.
Even I think
Thank you.
the caffeine drinks, the Red Bull, etc.
They're
They have
terrible.
low sugar.
Yeah,
Yeah,
really bad.
absolutely. I will ask a quick. So I have a question. How does NHS dentistry work? Is it free for everyone, like medical treatment for all ages at all
It's
times?
not actually. So NHS dentistry is free until you're 18, or you're in full-time education. If you're on income support, tax credit, pregnant, people that are on pension credit. So a lot of people assume that NHS dentistry is free. It is for these certain groups of people, but it is heavily subsidized. So for example, a checkup on the NHS, I think, is around £23, as opposed to privately, you end up paying about 50. If you need, fillings, if it's one filling or 10 fillings, your price is capped at about £53. So in that respect, it is heavily subsidized, but income support, tax credit, pension credit, you don't have to pay anything. And children under the age of 18.
Okay, thank you for that answer. There's a question in the chat room. Does flossing bring gaps into your teeth?
No,
No.
not at all.
We don't talk about that.
Flossing doesn't. I think what people sometimes, I find that patients come in and they haven't been to the hygienist, and the hygienist cleans their teeth, and they've got this very thick layer of cement stuck to the back, and all of a sudden it's cleaned, and they think, oh my god, I've got gaps between my teeth. But flossing, provided you're doing it safely, obviously if you're being incredibly rough and pushing it in and all this stuff, it can damage your teeth, but as long as you're doing it safely, it's not damaging. It's actually very important.
Thank you. And we have another question. Is teeth whitening, is that safe to use?
Yeah, so teeth whitening that you get from your dentist is very safe. You have to be very careful not to get sucked into buying things online because they're not licensed. And I've had some horrendous cases of people buying, gel online, not knowing what's inside it, and it's burning their gums and causing ulcers, and they have permanent sensitivity of their teeth. So if you're going to do whitening, you need to make sure you do have it done by your dentist, because legally we are allowed to prescribe a certain percentage of gel, because it's a peroxide gel, so it's bleach in essence. So you have to be very careful what you're buying on eBay. I would not recommend it at all.
So are there any that we can buy from, say, Boots, chemist stores or?
I mean, you
supermarkets?
can buy, if you wanted to, you can buy teeth, like Crest whitening strips are available online. And I'm talking myself out of business now, but they are actually quite effective. They're very popular in the States, and they are now available in the UK. I think there are some teeth whitening websites that you can buy them. They are good. They do work. I don't know what's in them, but just be careful with gels and things not to buy anything online.
Okay. Again, on teeth whitening, which teeth whitening paste would you recommend? So I guess this must be toothpaste, which are whitening. Which ones would you recommend?
I think they're all fads, to be honest. I don't really think anything works.
Okay.
There's nothing in there that actually whitens your teeth. I know they say, oh, we're great, we remove stains and this, that, but you have to be careful, because there are some toothpaste out there that recommend, oh, we're great for stain removal, but they're actually quite abrasive. So just be careful. To be honest, I haven't found any that are particularly good. Yeah.
And even the whitening strips, do they actually remove the stains, or do they cover it with?
They remove them. I think they break them down. The Crest ones especially
Okay.
have only become licensed in the UK recently, and they are actually quite effective.
Okay, another question is, how has COVID impacted dental clinics? So we've read in the news that some clinics now have a 3-year waiting list. Is that the case? Yeah.
It has been, especially with NHS dentistry, because with dentistry, it's very high risk. So anytime we're drilling or we're cleaning people's teeth, we're generating a lot of aerosol in the air. So what we have to do is we have to leave our surgery for an hour. So we're leaving like 1 hour gaps between patients. And initially that was very difficult because obviously, especially with very busy NHS practices that are used to seeing, 30, 40 patients per surgery, they've literally had to half the number of patients that they can see. But I do think now, hopefully, as things are beginning to improve and people are being vaccinated, I know that I've cut my time down from 1 hour to 15, 20 minutes between patients. So I'm able to see a lot more, but I am quite lucky that I see private patients, so I don't really have that, 10, 15 minute pressure that NHS practices have. But there definitely is a big backlog that they're trying to get through. So I've noticed a lot of practices aren't really seeing patients for their routine checkups and their routine cleaning as yet. They're just trying to get through their emergency because we were closed for about 3 to 4 months. So once they get through the backlog, but I think with time now, as things are improving and the risk is reducing, I think we'll slowly be getting back to normal.
Okay. And in case of where dentures have replaced teeth, is it advisable to have dental implants?
Every case is different. I mean, you have to have enough bone, and the quality of bone has to be good enough. So that's where you would have to see an implantologist, and they usually do a CT scan of your jaw. Dental implants, if, for example, you have no underlying health conditions, you're not a smoker, you're not diabetic, are the gold standard of replacing missing teeth. But you have to be, often a lot of people that have lost a lot of teeth through, for example, gum disease, your quality of bone is not good enough for implants, but implants are the gold standard in terms of an option for replacing missing teeth.
We recently visited a home for the elderly, and there was a resident there who was talking about dentures and how they're causing problems. I suggested also to have dental implants, and of course over here it's very expensive. And just going back to the you called it the dental tourism. He was mentioning Turkey as a place to go for treatment, which is a fraction of the price, but as good as here. So that's quite an interesting topic, especially for the implants, which are quite expensive.
Yeah, because you have to be very careful, because if an implant fails, your aftercare is not covered in the UK if you've had treatment abroad, and you will end up paying a lot more than you did. But I do think with implants, especially if people are in care homes, implants are they are surgical procedures. So, they need to be able to get into practice and have treatment done. I think, somebody's asking a question at the bottom. Are you writing them down, or should I answer them?
We'll get to them. So you take your time, answer the questions, and I'll get to them.
That's fine.
Okay. Next question. So what is the criteria to have braces?
So on the NHS, the criteria is quite strict now with regards to having braces. So they have quite a strict criteria. It's called the IOTN. So they look at the functioning component of, for example, a child's bite, as well as the aesthetic. I mean, how it's looking from a cosmetic point of view. It is, the criteria goes way above my head, but you would have to see an orthodontist. But if your IOTN score is a 4 or a 5, then you're covered for braces on the NHS, which means you would not have to pay. But if you fall below a 4, you're given options for private dentistry, which is quite annoying actually, because I think it was 2006, all children could have braces regardless of how minor an issue it was. But now the criteria is a 4 and a 5, and it's quite a difficult criteria to go through on Zoom, but all children are eligible for a free orthodontic consultation. So you can get your dentist to refer you to the orthodontist, and they will grade the severity of the case and then let you know whether you're eligible.
Okay, thank you for that answer. There's an interesting question. Would you be able to advise on temporomandibular disorder, and is there anything that can make this better?
Yeah, so with that, your first port of call would be a bite guard. It depends. A lot of people have, it's called your TMJ disorder, where people are clenching and grinding, and it's putting a lot of pressure on the jaw joint. The first thing I would recommend trying is a bite guard. I have some patients that, for example, are, COVID has not been kind to people, and they've been clenching a lot during the day. So you can often wear your guard during the day or at night when you're sleeping. There are various types of guards that you can have. You can have soft, flexible guards, which I would recommend starting with. And if that doesn't work, because I have some patients that chomp right through that, and then they need a flexible, but also you can consider Botox in your actual jaw muscle. And what that does is it weakens the muscle, so it takes the pressure off the jaw joint. It's not something I'd recommend as a first treatment of port of call, because if, for example, the Botox diffuses into the muscles around your mouth, it can affect your smile and your chewing. So first of all, we always recommend trying a bite splint. And if that doesn't work, I find Botox really does help ease and take the pressure off the jaw joint.
Would that have to be renewed regularly if the Botox?
Yes, so Botox, it only lasts about 4 to 5 months. So I think Botox in the jaw, I would probably recommend having done twice a year, because the more you weaken the muscle and you get to it before it regains its strength, it's better. Otherwise, it just regains its strength and you're back to square one again. So if you can try and get to it. Unfortunately, it's not really covered on the NHS. It's only if it's quite a severe case can you get a referral to a local hospital, and they will offer you Botox for your jaw, provided you've tried all other treatment options first.
And what's the cause of that? Is there nothing to just prevent?
It's a hard one. I think life these days is so stressful. Stress is the number one cause of grinding. I mean, another rare cause is some people get arthritis in their jaw joint. If that's the case, then Botox in the jaw will not help. But occasionally, seeing a specialist in the hospital, having a steroid injection in the jaw joint can often help. I currently have a 13-year-old patient who's suffering from early onset arthritis of her joints, and it's very badly affected her jaw, that it's just eating away at her jaw. So, but that's quite rare. Stress is the number one cause.
Yeah. Thank you for that. Another question is, what do you do if you have a big gap at the front? So I suppose between the front teeth.
It depends on the cause of the gap. Sometimes, for example, if you're a child, children often have quite a deep muscle attachment from here to the roof of their mouth, which is causing this gap. In that case, it would be a referral to the orthodontist. They can often cut the muscle attachment and use a brace to close the gap. If you're an adult and, for example, you've tried everything, often you can add some white filling to the insides of the teeth to kind of make the teeth a little bit wider to close the gap. The disadvantage of that, obviously, is it can chip, it can break. It depends on how wide the gap is. Another option are things called veneers, which are almost like false nails, like little ceramic covers that you can put on teeth. And that's quite good for closing the gap. But for example, if you're suffering from underlying gum disease and your teeth are moving and that's why your teeth have drifted, it's very difficult, because your teeth will just carry on drifting no matter what you put in there. And you cannot have a brace if you have underlying gum disease, because you can cause your teeth to become more loose. So it depends on the reason why you have a gap.
Another question: how can the elderly or extremely immobile people access dental services?
So if you call NHS 111, you can there are domiciliary dentists who actually visit nursing homes and care homes, and they have almost like a mobile unit which they can bring. Obviously, the treatment that they can provide is limited, but it's at least it's for example, making dentures or making people comfortable. So they're called domiciliary services, and they do exist in the NHS.
It's very useful to know. Another question: how to avoid having plaque in your teeth? How can you do it?
So avoiding plaque, brushing really well twice a day for 2 minutes, flossing or using little interdental brushes to clean in between your teeth, really important, because we all naturally get build-up, and some of us get more build-up than others. For example, if our saliva contains more minerals, no matter how well we brush, we still get a layer. But if you're flossing and using something to clean in between your teeth, you will get a lot less.
Thank you. Another question is, what would you advise when searching for a good dentist? So we have one in front of us at the moment, but
I think nowadays, looking, online, there are Google reviews, Facebook reviews, and word of mouth, I think, counts for a lot. So asking, family and friends. I think it's unfortunate that no matter how good a dentist, if patients have one bad experience, they're just off you for life. So you have to take everything with a pinch of salt. but definitely recommendation. But online now, we have a thing called in the NHS called a friends and family test. So I think that's available on NHS 111, but your friends and family test are actually available for the general public to see. We haven't been doing it for a year because of COVID, but that's a good way, because that is actually patients come out and they actually give you a grade just like in the hospital. And that's a really good way to gauge whether you've got a good dentist or not, because unfortunately we have got very bad reputation, especially private dentists, of just wanting to make money and not really treating you ethically. So I definitely think word of mouth is a good way to go.
Okay, thank you. Another question, is miswak a good substitute for toothpaste, and is it safe to use after every meal?
It's a tough one, because I know obviously from a religious perspective, the Prophet used it. I still feel, yes, you can use it as an adjunct alongside brushing with fluoride toothpaste if you want to after a meal. It's not detrimental, it's not damaging if you want to carry on. But in terms of its efficacy and how good it is, it's questionable. But I'm not going to say don't use it, because I know obviously the Prophet used it and the religious connotations behind it. That's fine, but I wouldn't use it as a substitute. You still need to use a toothbrush as well.
And there's no harm in doing it after every meal, or is that too much, too excessive?
Again, as I said, trying not to just use anything for a good 45 minutes after a meal, because all the acid in the mouth, so even a miswak can damage your teeth.
And another question is coming up. What to do when you keep having inflammation of the gums?
So inflammation can be caused by various things. The commonest cause is obviously oral hygiene is not great. We definitely recommend coming in to see the hygienist, because usually we don't realize we've got a lot of plaque built up around our teeth, which is irritating our gums and causing them to become inflamed. Mouthwashes such as Corsidil. Corsidil is very good to use if your gums are inflamed, but only to use for short bursts. So not to use for long periods of time, because it can cause quite a lot of staining and altered taste. There is a Corsidil Daily, which is actually I'd probably recommend more if your gums are inflamed. But inflamed gums, yes, hormonal changes can cause your gums to become inflamed as well. So it's really important to get to the reason behind it. But the commonest reason is not brushing properly and poor oral hygiene.
Thank you. There's a question, I think it's related to Hajj. So is there a fragrance-free toothpaste? Because on Hajj,
That's a good question. I can't remember, because when I was going on Hajj, I can't.
Perhaps mint might not be classified as a perfume. Maybe. Well, that's a religious.
I don't think but I think normal toothpaste is allowed. Because I think it's more, for example, fragrance-free soap, that you can't have anything fragrant on your body. But I think all toothpastes they have mint flavor rather than scent.
Yeah, I think there's baking soda toothpaste, which I've tried before, which don't have a taste. The taste.
I mean, I guess if you're going on Hajj, you could take it, and however many days isn't going to do anything. It's a good question, actually.
Yeah. Thank you. And another question: blockage of the saliva duct. What do you advise?
There are various options. You definitely would need to get referred to see an oral surgeon in the hospital. Often they tend to break down themselves, but often they may need a certain type of laser to try and break them down. So I would definitely recommend getting your dentist to refer you to an oral surgeon.
Okay. Questions are coming, but I'll ask another one. Do you advise hydrogen peroxide? I think you said that was something to avoid, but that's a question.
Hydrogen peroxide in tooth whitening gel, provided it's a safe. In this country, the maximum you can have is 6% hydrogen peroxide, no higher than that. So for tooth whitening, yes. There are hydrogen peroxide also based mouthwashes, one especially called Peroxyl, and that's actually quite good for your gums. So I don't know in what respect you're talking about. In terms of tooth whitening gel, the maximum legally we're allowed to prescribe is 6%. But I don't advise anybody, trying to brush their teeth with bleach or anything like that. But but yeah, it's called Peroxyl as well. So there are various benefits to hydrogen peroxide provided it's used safely.
Okay, that's good to know. Is there anything natural that we can use to remove discoloration by tea?
I mean, there's a lot of things on social media these days about activated charcoal and bits and bobs, but I'm not really that convinced.
Okay. Yeah, another question. So there are various everyday infections. Until we have another question, we could perhaps go through them. What we can do, you mentioned Candida, that untreated can lead to cancer. So what can we do to?
Yeah. So with regards to Candida, obviously you'd get like a white coating on your tongue or in your mouth, and it could be quite painful, red patches, bleeding. It can be quite sore. So again, you would need to go to your dentist and they can prescribe you antifungal medication, sometimes lozenges or a mouth rinse, and that can help. Because also as we age and people lose their teeth, we tend to lose support around the corners of our mouth, and our mouths start to droop. And so saliva starts to collect in the corners, and you can get quite bad fungal infections there as well, which is why it's so important, even if you don't have teeth, to come in and have everything checked.
So if it isn't easy to get an appointment, are there things that you can buy over the counter or you can do at home?
In terms of, you can, I mean, Corsidil and mouthwash you can buy over the counter. Antifungals, I'm just trying to think, usually you can occasionally get lozenges over the counter as well for thrush, but the thing is you have to make sure that it's diagnosed thrush and not anything else. That's the thing.
Okay. So a question actually has come up with the last item on the list was to do with bad breath. So any treatment for dry mouth and bad odor from the breath?
So for bad breath, what's quite good is to get a tongue scraper, a tongue brush, and actually everybody should just, it's really good just as it getting into your daily habit, especially before bedtime, is to brush your tongue, because a lot of bacteria sits in our tongue and that can be responsible for bad breath. There's quite a good mouthwash called CB12 or Retardex, and they're quite good for bad breath. But again, the commonest reason for bad breath is underlying gum disease. So I can't emphasize the importance enough of obviously, having a good clean with the hygienist, because bacteria likes to sit in a little pocket around in our gum, and it releases gases which lead to bad breath. So a lot of that is to do with good brushing, but brushing your tongue. With regards to dry mouth, again, you would need certain medication, for example, antidepressants, blood pressure medication can lead to dry mouth. And that's quite a good question, actually, because saliva in our mouths, saliva protects our teeth from developing cavities and tooth decay. So it is very important to address that. I mean, some things like sugar-free chewing gum, chewing on that regularly is good. Sipping water. You can actually get artificial saliva spray, which can be prescribed by your dentist or your doctor. You do have to be careful because a few of them actually are based from pig mucus, but there are vegan ones available as well. So certain things like that. So you can get saliva spray, just sipping water regularly, sugar-free chewing gum, are all good ways to stimulate your saliva.
Thank you. There's another question about natural remedies. So rinsing your mouth with coconut oil to help with gum problems or to prevent them. What have you heard, and what do you think of those?
There are no clinical studies to show that coconut oil is beneficial for your teeth at all. I'm a really, my mom's going to say I'm very bad when it comes to, herbal remedies for teeth. I don't necessarily agree with it, but coconut oil, genuinely, it doesn't do anything.
Yeah.
Good for your hair, but that's about it.
Thank you. Okay, I'm just trying to find the question. So do you recommend the tablets that are sold for children where they let it dissolve in them? Okay, so the disclosure tablets, would you recommend them?
Very good, actually. I should have mentioned those, but it's a really good tool to make sure your children are cleaning their teeth correctly. And the best way to use it actually is not to tell them. So get them to clean their teeth at night. And then get them just to chew on half a tablet, because one tablet makes so much mess in your sink. And then all the areas that show up in purple or pink are the areas that they've actually missed. And I think it's a great way to educate children on the areas that they're not cleaning. And I mean, I use them as children. I do think it's a very good tool, not necessarily to use every day, but maybe just to do a little spot check every now and again is good.
It is quite a visual shock to see that how much you can leave behind. So that's
And I think for adults as well, sometimes I do recommend them to adults because they seem to tell me they're doing a great job cleaning and they have no idea how much they've left behind.
Yeah. There's an interesting question. Do pets need any dental health, and cannot brushing teeth lead to death? For pets? Yeah, I think.
No, I think there are actually veterinary dentists around. So I do think just the same, the same conditions that humans can get, I'm sure animals can get as well. Unfortunately, I'm not trained to speak about animals, but I do know, for example, my nurse has a horse and she regularly has regular veterinary dentist comes and checks their teeth, and
wow, okay.
Have to be careful now.
And another question, what do you advise for a 3-year-old with holes in his teeth?
You need to firstly take them to a dentist ASAP to get these holes treated. Chances are if they're quite big holes, then they may need to have the teeth removed in the hospital under general anesthetic. But moving forward, really need to address why the child has holes in their teeth at the age of 3. So something like just keeping a diet diary, just making a note of what they're eating and drinking, and eventually, you can pick up a pattern if actually, they're having a lot of this or a lot of that, because at the age of 3, they are very young to be having holes in their teeth.
Is there anything that you would emphasize with regards to dental care, I think, for children?
Brushing for children, again, brushing twice a day with the fluoride in their toothpaste. A lot of children's tooth decay is caused by sugary snacks, sugary drinks. So limiting, really watching what they're eating, what they're snacking on between meals, making sure, because making sure they go in and to see the dentist, because a lot of parents, especially as children get older, they don't really check their teeth to make sure they're cleaning them correctly. And I would say right up until the age of 7 to make sure you're clean, that your parents are supervising and cleaning their teeth. Because I know with my own children, I will give them a little egg timer. After 30 seconds, the egg timer's in the bathtub and they're running out the door and they've only just cleaned the tops of their teeth. You really need to make sure they're getting all the way down to the gum line and cleaning properly.
We have a comment actually that, where do you practice? I would like to sign up. I think you've impressed everybody here.
I practice in a place called West Byfleet in Surrey, so it's near Woking. And we can leave our practice details below, and you're welcome to call and register if you like.
I'm just now going to, these are the details in the chat room. So the top part is for the project, the Community Companions project, and the bottom part is the name of the clinic. So IQ Dental and Aesthetics Clinic in West Byfleet, Surrey.
It's about 25 minutes drive from Hounslow, so it's not too far. But unfortunately, I don't have an NHS contract at all because of where I'm based. So I do see patients on a private basis and children on the NHS or for free.
Okay. Another comment is that it has been said that fluoride causes health issues. What do you advise in this?
Fluoride in excessive amounts causes health issues, but the amount of fluoride that is in toothpaste, and provided you're not swallowing it, actually the benefits far outweigh the risks. We have fluoride in our water. For example, I was raised in Northern Ireland and we didn't have fluoride in our water, and the rate of tooth decay in Northern Ireland and in Scotland is actually double that of of England. And it just shows that the benefits do outweigh. I think a lot of people panic and they say, oh, it's toxic, and it's toxic in huge amounts if you ingest it. But to be honest, nobody's going to ingest that amount of fluoride. And actually I would say that it's just like, for example, people saying, oh, dental x-rays, there's so much radiation. There's actually more radiation coming out of your mobile phone than there is having a dental x-ray. So I just think as long as you have a balanced view, but actually the benefits of fluoride far outweigh the risks, because the risk of fluoride toxicity is so low.
a question is that what is a good toothpaste for children and adults?
So as I don't know whether you missed the beginning of my talk, but
Yeah.
any toothpaste is fine as long as it has 1,400 ppm fluoride. So if you read the back, as long as it has that, it's fine. It doesn't, because some children really struggle with the transition from children's toothpaste to adult toothpaste because it's very minty, it's too spicy, I don't like it. Pick your battles. It actually doesn't matter as long as the fluoride content is that. They can use it until they're 90. It really doesn't matter at all. And if they want to use strawberry or fruit flavored, as long as it has that amount of fluoride, you can use any brand.
Thank you. Another question is again on the miswak, but you have answered that. Do you have knowledge of the miswak?
I mean, I know what it is. I don't, as I said, I would still recommend cleaning with a normal brush, but obviously in between you can use a miswak.
Any more questions? I think so far that we might have reached the end of the questions. There's been so much to learn. It's just been so interesting. Let's check, maybe on my phone I'm getting something. Yeah, I think that's it so far. I did ask you about geographic tongue in the conversation, but I think you mentioned that it isn't harmful.
It's not. It's just where some people just have patches on their tongue. So it's just in general in their appearance. It's not painful in any way or dangerous. It's just that is just the way their tongues are. I mean, some people it can affect their taste buds a little bit, but there isn't an actual cure or anything you can take for it. It's just something to get used to as such.
Okay. So any comment? Oh, okay, another question. Can braces that are glued to the inside of your teeth be removed?
Yes, they can. They can be removed. They're not really. There are. Does she mean a wire, or do you mean braces? You can have braces on the inside of your teeth. They can be removed because they're not. It's not permanent. Oh, a wire. Yes, your wire can. Your wire can be removed. But I mean, it depends. If your wire is broken, then I'd recommend removing it because your teeth can drift. But if the wire is fine, I would keep it there because it genuinely does help keep the teeth in place.
Do you recommend the Invisalign braces, the ones that are molds?
I think Invisalign is becoming more and more popular, even for children nowadays as well. It's amazing what Invisalign can do. Initially it could only do very, very minor corrections, but now they can. It works really well. The good thing about Invisalign is if you have a special occasion or anything, you can take them out and leave them out for a day. So that's not too much of a big deal. But they're huge. I mean, they're really, really popular, especially adult braces now there's a huge market and huge demand for it, especially after lockdown when people have just been staring at themselves via Zoom. The number of Invisalign cases has gone up quite a lot, and it's very easy to tolerate compared to normal braces, but it's not available on the NHS. It's a purely private treatment only. So you have to just be aware of that, even for children.
And I think you use them for a shorter amount of time than the average, the wire braces?
Not necessarily. It depends. I mean, every case is different. There's some people that 2 years later, they've still got their Invisalign. Every case is very different. Some people can be fixed with a normal brace within 6 to 8 months. Others, it may take 2 to 3 years. It just depends. But I think personally, I think for children though, even if you can afford Invisalign, I think you have to be careful because you're really relying on compliance of the child, making sure they're wearing these trays for 22 hours a day. Whereas when you have fixed brackets on your teeth, they can't take them off. They don't have a choice. So I think even for my own children, I would still go down the route of having fixed braces because, I don't trust them to take their Invisalign out whenever they feel like.
Yeah, so that's a very good point. So we have a question from an 11-year-old actually, that is removing braces painful?
No, it's just, you feel a little bit of whizzing and a little bit of water when they're taking it off. But I think having braces put on, it's not painful, but that's the worst thing to get used to because it feels quite tight. But removing it isn't painful.
Okay.
And you should be excited about having it removed because finally you've finished.
You're free. It's true. Another question, we are running out of time, but quickly, is it true that drinking milk from a bottle at night can affect the direction of growth of the teeth?
Not necessarily, because the bottle is not in your, drinking milk at night can cause holes in your teeth, but it doesn't affect the direction because children very rarely suck on this teeth all night. If they're sucking on it all night, then yes, just like a dummy, you could end up with, it's called an open bite where the teeth do not come together. But the one advantage is as soon as you get rid of the bottle or you get rid of the dummy, the teeth will go back to normal. So it doesn't really affect the direction, and it's quite soft, the teeth. More than a dummy will affect the bite more than a bottle, to be honest.
And the last question, what foods strengthen the teeth? What are good for the teeth?
I think obviously, foods that are rich in calcium are good, milk, cheese, multivitamins, but there isn't anything specifically that is known to strengthen the enamel.
So we generally think of milk as being good for the teeth, but it's more.
Yeah, I think calcium related things we think are good for the teeth, but we've never really been taught that these foods are good in terms of strengthening the teeth. That's why I'm very pro fluoride, because fluoride is the one mineral that is clinically proven time and time again to strengthen the teeth.
Sadly, we have run out of time. Just checking. Yes, that is the last question.
If anyone has any questions, they're welcome to email me or message me afterwards.
Yep, and we have a WhatsApp group. You can send messages in there and I can forward them and again return in there. So, and if you'd like to offer any feedback for the session as well, you can do so in the WhatsApp group for the workshop. I'd like to thank the attendees for your time and attention, and we hope you found this topic very useful. I'm sure all of us will take away from these best practices to establish so that we can have a good oral health routine for the rest of our lives. I must mention here that Zahra is Sister Farzana's daughter, mashallah, and both mother and daughter are an inspiration.
No, alhamdulillah, no, you all are an inspiration for us and encouragement we get. So, alhamdulillah, I hope you're all satisfied with Zahra's talk.
Jazakallah khair.
Especially the great thing with
Yes, I think we all are. We have so much information to take away from here today.
And I have learned also a lot tonight. From
not to give my children bedtime snacks.
Oh, this is the thing.
I hope this convinces you, Sister Farzana, not to do that.
I know.
Finally.
Finally, and thank you so much.
Jazakallah khair so much. And
Thank
all
you
of
so
us,
much.
thank you for
Nice to
engaging.
meet you.
Thank you. Nice to
You're
meet you.
welcome. Take care.
Assalamu
Wa alaikum salam.
alaikum.